Chronic obstructive pulmonary disease, or COPD, is a chronic respiratory disorder, usually caused by smoking or inhalation of pollutants. The two main types of COPD are chronic bronchitis and emphysema. Chronic bronchitis is caused by ongoing exposure to smoke or pollutants. Airway defenses hyperreact, causing inflammation, constriction of airways, and too much mucus for the cilia to clear. This narrows and blocks airways, inhibiting overall ventilation. In emphysema, the tissue of small airways becomes damaged. The airways collapse on expiration and trap air in the alveoli. Expanded and unable to contract, the walls lose elasticity, reducing compliance, and may eventually disintegrate. Both of these diseases are characterized by difficult labored breathing, known as dyspnea. The patient needs to use the accessory muscles to force air in and out of the lungs, sapping the body's energy and resources.